Welcome back to Plastic Surgery Untold. We got our guest co-host, celebrity plastic surgeon, Dr. Adam Weinfeld.
Yeah, hey, excited. We're going to talk about brow lifts today. We're going to do it quickly. We're going to do it efficiently, but it's a really, it's an important topic. The reason for that is that when we interact with one another and we're talking with one another, we look at people's eyes and we look at people's mouths. That's where we spend a lot of the time focusing on the face. And so the area around the face, the periorbital region, is a really important aesthetic area. And patients want to look as good as possible. And so one of the things that impacts the appearance of the periorbital region is the position of the brows, whether they're too low, whether they're flat, and then also the amount of skin in the upper eyelid. Not to mention the fact that as we age and those tissues descend, we also see some sort of sinking, some descent of the temple tissue, which in a very subtle way can create an older appearance. And so a brow lift is a wonderful way to address the aging that we see in that periorbital, that upper periorbital region. Now, I almost caught myself because really, Shauna, I imagine you see this too, but you're starting to see a lot of patients who are younger who are wanting to have brow lifts, really to shape and sculpt their brows. And so, I have a tendency to go on and on and on. What I'm going to do is I'm going to bounce this. I'm going to bounce this to Sean, because I know he does a lot of these procedures too. Maybe, we had mentioned as we were getting prepared for this about talking about the endoscopic brow lift. I think that's important to address, but there's also other types of brow lifts. So maybe you and I can kind of go back and forth, but I'll sort of pass the baton to you and have you speak about whether it be the endoscopic brow lift or whether it be about some of the non-endoscopic approaches to the brows.
So the endoscopic brow is probably my favorite one of those lifts. And so I'll talk a little bit about that. It's the newest technique I've sort of added to my armamentarium. But I've loved the results I've gotten with it so far. I love that you can put 4 or 5 small incisions hidden in the hairline until you never really see them. They heal beautifully because it's the scalp, and the scalp has very great, regenerative potential. But then you just use those small little incisions, dissect through the right plane to the area around the brow, like you were saying, release the kind of the ligaments that keep our brow down so you can elevate it up. And then I like to use the endotines. I'm not sure what you use, Adam, but the endotines are really great, so you don't have a lot of extra foreign bodies that dissolve over time, just to help support and lift that tissue. And then you can do some great shaping, as you were saying, so where you can get a beautiful arch, or you can, if someone's got a really flat brow, you get the arch, or someone feels like their brow is too arched, you can help elevate certain portions of that brow to sort of shape what you want. And then one thing that I've even done a little bit of now is extending that dissection down into the midface. So that way, not only are you changing the brow, but you're also changing the fullness and volume in the midface. So it's almost like a mini facelift for some folks. And when you change that whole region, it just restores such a youthful appearance to the face. That fullness in the malar region's back, the brows lifted. People their eyes look brighter, more sun hits it. You can see the makeup, all those things. And people stop asking you why you look so tired all the time. So patients love that.
I'm so glad you mentioned the midface because it's interesting. A lot of people recently have shifted to sort of a subcutaneous temporal incision for a brow lift. And I think the reason they did that is that depending on how you use the brow lift, you may or may not get really good sustained elevation of the brow. You mentioned 4 or 5 incisions. And so I can tell already, while I've not seen how you do it, you're definitely using some lower lateral incisions. I think that when I've heard of people who've become dissatisfied with brow lifts, it's because they're using, 1 central and maybe 2 lateral incisions, and they're not doing what I now know that you do and what I do as well. And with those 2 lateral incisions a little further out, you really do dissect down into the mid-face, and you really can elevate the temple, the upper cheeks, even some of the mid-face. And when you lift all of that tissue together, and you support all of that tissue essentially from here all the way around 180 degrees, even more, it's much less likely that you have a redescent of the brows, because it's not just the brows that you're repositioning. It's really everything. It's like half of the face, or at least a third of the face. And I think, and so I'm so glad that you mentioned that, because that's something that I think that is not appreciated, how it's really not just a brow lift. An endoscopic brow lift is not just a brow lift. It's not even just a forehead plasty, just reconfiguring the forehead, but it really does have results that can come way down into the temples and even into the upper mid face. So very powerful procedure.
Do you guys think that you're going to see more of this in the setting of this weight loss? Because there's definitely some people that just have congenitally heavy brow stuff, but I could see people who are super young, not really ready for a full face and neck lift, and just feeling like they're a little bit sad, a little bit down here. And I feel like this is something that could really open up the face with very little telltale signs that they ever had something done once the bruising and swelling goes away.
The answer to your question is yes, I think we will. I've not actually seen that population, come into my consultation room yet, but I will say, sort of similar question, I've done as many brow lifts on patients below the age of 35 as I have above the age of 35. And so it really is a procedure that suits patients well, who are starting to feel as if they're looking a little bit old, but clearly are not, ready for a full face and neck lift.
I love that, because people who are young and this is the prime of their life, they're living, their fabulous life, they're active, they can do something about it without all the typical incisions of a facelift. So great to know that there's something that they can do if it's something that bothers them, in a, I'd say, minimally invasive way.
Absolutely. Less incision burden. I do feel like the recovery is a little bit easier when you're using the smaller incisions, because even though you're dissecting a pretty large area, you just don't seem to get the same amount of swelling that you get after a facelift. And I feel like the results, they get back to life just a lot quicker.
I'm gonna say this, and then either you or I are gonna have to describe what an endoscope is, because we didn't really do that. But
exactly.
But I think, Sean, part of the reason that we see that too is that most of that dissection is purely periosteal. So it's like it's between, you're lifting the soft tissues directly off of the bone, and so and all the lymphatics are still undisturbed. The only area that you're really cutting across soft tissues is here, and then also
temporal
if you're releasing, exactly. So I agree with you. I do think patients stay bruised and swollen a little bit less time than if we were using some other techniques. So what's an endoscope? Should someone answer that?
Yeah,
Should we make Johnny
let me
do
do
it?
that.
No, we'll have you do it. No, we're gonna have you do it. We're gonna have you do it.
As the only board certified general surgeon, I'll take that one.
Yes, go for it.
So an endoscope is a camera, a fiber optic camera that is usually paired with a small metal tube, which lets us extend the field of view. And so basically we use a small tube and camera to look inside of the area we're dissecting to get a really nice, crisp, clear view. And endoscopes have come a long way from something that was basically you would see on, big, heavy instrument, 10 millimeters, now all the way, I think our endoscopes are 3 millimeters in width. So they're tiny little cameras, or tiny little things that we can use to sort of peer under. And the image quality is fantastic. It's high definition, 1080p. So you can see every fiber, every strand, every vessel, and so
it's magnified too.
And it's magnified, so you get a beautiful view of your dissection. You can see anything before it becomes dangerous, and it just helps so much and keeps those incisions really small. Now, I saw a lot of masters that trained me and have to do these who they didn't need an endoscope because they could do it with their eyes closed. But for the rest of us normal folks, I feel like the endoscope is really helpful to visualize and know exactly what you're doing, but also to make sure that we do a nice, safe procedure.
Yeah, I think you're right. You could use a retractors and a headlight to do some of what we do with endoscope when we're doing a brow lift. But I think if you're going to go down into the mid-face area, at least I would want to, when I'm kind of coming across and down around the temporal nerve and things of that nature. But you're right. You can actually, it's surprising how much you can see even with just a narrow retractor.
It's amazing how much technology has made, these surgeries safer with minimal incisions, how much more precision we can have. I mean, remember the old days of endoscopic breast dogs where people used to use this big urethral sandwiches, big long kind of silver stick stuff where you just kind of space plasma cooled water and then hope for the best.
Yeah.
Now you can actually see stuff. And I think for those of us that grew up in the video game era, I mean, we've been practicing all of our life for this.
Yeah.
But the views are actually
They're fun. Yeah.
and the views are actually better sometimes than you can see in an open procedure because of the 4K, television screens and stuff, and you can really zoom in on things. And so the old days of the grainy TVs are gone. I mean, the visualization is absolutely fabulous.
Or even looking through the scope.
Yeah.
Yeah. I think, and it's from a surgeon's perspective, a lot better on our posture because we're like looking up at a screen instead of looking down.
Yeah, I will say just from general surgery, I think we all did a little bit of general surgery in our training, at least, and the endoscope changed the course of general surgery, and it's continued to change that. And now we're starting to see that really come into plastic surgery and really change the course of plastic surgery. So I think you're going to start seeing it a lot more applications, people looking for newer and innovative ways to use these endoscopes. And I love the mid-face aspect of it because you can do so much, so powerful, just as you were explaining, Adam.
Yeah. One other thing I'd like to mention is that as part of some of the gender affirming surgery they do, but even in cis women who have prominent forehead ridges, I can use a guarded burr to help burr that down, and I do that all through the endoscope, and it's almost always done in conjunction with lifting the brows. So that's a pretty powerful adjuvant. But I've done it, again as part of just regular, facial rejuvenation for women who have prominent brows, and then also for women who are doing it for gender affirming purposes.
Well, I think this has been absolutely fabulous just to kind of let people know about some of the new technology procedures that are out there, the brow lift, mid-face lift, and then to be able to do this endoscopically, because I'll tell you, I don't really do a ton of these procedures, but it's interesting to hear some of the biggest concern is people just don't want some of those telltale signs, especially when they're super young. And really, I mean, you'd have to really work hard to find these incisions because they're hidden well in the hairline.
Yeah.
It can make a big difference for some of our young patients. So appreciate you guys sharing all that knowledge with us.
Yeah.
Thank you guys.
Thank you for tuning in to Plastic Surgery Untold, greatest podcast in the world, is voted by us. You can listen to us anywhere where you get your favorite podcasts: iTunes, Spotify, Pandora, iHeart, or watch us on YouTube. We'll see you guys soon.
All right. Bye-bye.